Thank you so much for joining us for what I know is going to be a lively and really interesting discussion. I'm going to mainly let my speakers do the talking because they've just got incredible stories to share and just, yeah, a lot of information to share. So today we're going to be talking about this intersection of immigration and health and how what's happening in immigrant communities, what's happening in underserved communities affects all of us, not just not just those communities themselves. And so I think today we're going to learn a lot about like, you know, we see these ICE crackdowns and Operation Metro Surge, what that means for healthcare, what that means for community health, and talk a little bit about why traditional hospital systems, medical systems aren't set up to really deliver this kind of care. And so with that, let me introduce our speakers. First, we have Munira Maalimisaq. She runs the Inspire Clinic. Munira, you can come join us. I'll introduce you. So Munira moved to Fargo, North Dakota from Somalia when she was 9 years old. And she eventually became a nurse practitioner. And on a sunny October day last year, she opened the Inspire Change Clinic here in Minneapolis. The clinic's mission is to support underserved communities with culturally sensitive care. But less than 2 months later, Operation Metro Surge swept through Minneapolis, and all of a sudden, fulfilling the mission of the clinic, I mean, it required a total change of course, which Munira did, and she'll talk about that today. And you know, today, what she's going to talk about is how the clinic had to do a total 180 to meet the moment and deal with this ongoing aftermath even today. And let's welcome Georges Benjamin to the stage. Everybody knows him. He doesn't need an introduction. I'm going to introduce him anyway. So Dr. Benjamin's led the American Public Health Association for more than 2 decades. And I mean, I've seen so many people come up to him and say hi to him at this conference, so so many of us, you know him and have spoken with him. But prior to that, he served as the Secretary of Health for the state of Maryland, and he led public health and emergency response in Washington, D.C. He's also a physician. He has too many honorary fellowships and publications to list here, but I'll list one. So he co-authored a book called Public Health Under Siege, Improving Policy in Turbulent Times, which is going to be particularly relevant for today's discussion. So please welcome my panelists and let's get to it. Okay, good, great. So Munira, I wanted to start with you, and I wanted to start a little bit with your personal journey. If you can talk us through, you know, how you came from Somalia, ended up in North Dakota, became a nurse practitioner, and then eventually opened your own clinic. Can you, I know that could probably be the whole session, but maybe you can briefly talk about your journey.
Yeah, thank you so much for having me. So glad to be here. Yeah, we came here to Fargo when I was 9 from Kenya. Beforehand, we were in Somalia, Kenya for 9 months, 10 months-ish, and stayed up here. And when I got to Fargo, it was November, really cold day, snowing. And the first thing I remember is getting home and someone showing us how the house looks like. We had someone from the Lutheran church there, and I'll never forget what service means. That's the day that I learned. Someone asked me the other day, what does generosity mean to you? And to me, coming here, seeing that Lutheran social worker at our house, I didn't know what she was. I just knew it was a white lady that welcomed us, and I was just happy to be here. And she showed us all the rooms, but my favorite room was the kitchen because it had vanilla ice cream, and that was so exciting. But that was me. We lived there for a while, came here after high school, and never went back. Now I can't imagine living in any other state or country besides Minnesota. Minnesota has shown us, the people, how amazing they are, and I just love being here.
And what drove you to become a healthcare practitioner and open Inspire Change?
So many different things, but there's something called latent TB. I think Betsy would know. And I remember I was being treated for it, and my mom, my dad, no one understood why I had to take medications.
Latent tuberculosis.
Yeah. Mm-hmm. And she's like, my daughter is not sick, or But they were like, she has to take her medications. But no one took the time to educate my parents or myself. And at that time, someone would actually come to your house and give you the medication in the beginning, especially if you were a new refugee. And it just felt wrong. I didn't understand what was going on. Even as a 9-year-old, I knew that that's not what healthcare should be. Just not understanding why we were getting the medications. I became a healthcare management, a bachelor's degree as a healthcare management, and did that for a while at a nursing home, because I thought if I'm a leader, I can change something. And I didn't like that part. I wanted to be with patients. So I went back, got my master's in nursing, and went back, became a nurse practitioner now, and worked at a large healthcare organization that I loved. I never thought I was going to leave. But there were some things that I wanted to do. I wanted to be in the community, making those changes, educating patients on health literacy, and wanting to see if they understand their care, how do they show up in the community? How do they share those stories? And will that help in how they're interacting with their healthcare doctors anywhere that they go to. So we started a motherhood circle that still goes on. Tomorrow we'll have a session. But with this group, we started with 25 moms, and now we have 75 moms that come together once a month, and we talk about vaccines, we talk about diabetes, blood pressure, maternal mortality, or maternal health. Since May is Maternal Mental Health Month, that's something that we're going to talk about tomorrow. And it just gave them the space to learn from each other. Yeah. And that grew into a primary care clinic now. Yeah.
And George, just talk about, Inspire Change is this rural community clinic. And talk about the role of clinics like this just in the larger public health landscape.
These kind of programs in communities, these clinics, they provide a service because they're in the hood, and they can endear the trust. If you actually think about the relationship that you as the health provider have with your patients, of course you're reporters, and your job is to get us to say things that we may not want to say. And then you're great storytellers. Well, we have to do something kind of similar. We have to go and get sometimes people's most intimate thoughts, things they may or may not want to share, things where they haven't quite connected the dots, but we know enough about science and biology that we can help, when they tell us something, help understand what's going on with them. And then they allow us to touch them in the most intimate places and the most intimate times. And that requires trust. And then, of course, we give them a recommendation on how they can improve their health. And then we want them to follow that recommendation. It's not an order, it's not a directive. There are cultures where it may be more imposing than others, but in general, it's a recommendation. And then we want them to do it. And then we want them to come back to us so we can follow up and see what our recommendation did and whether it worked. That requires even more trust. You don't get that exchange in a business card in a big healthcare center with somebody you don't know. You get that over a period of time because people go to you because they trust you, they care about what you think, they believe you're there for their best interest. Despite the social things you're hearing about, physicians and nurses want to make money. Everyone understands that's not why they're in the business. You don't go to school that long and do that, for that as a sole goal. You're there to help people. So I think that these kinds of clinics and programs bring a degree of fundamental trust in the community, which is difficult to do in a big multi-sectorial health sector, when you have lots of hospitals and clinics, et cetera.
And you've got some examples of this. So I'm thinking of a couple in particular I read about, which is this really stunning thing that I had read about how there's a lot of vaccine hesitancy in the Somali community, and I guess autism rates are fairly high here compared to in Somalia, and vaccine rates, measles vaccination rates in the community have plummeted. I think I read that less than a quarter of 2-year-olds in the Somali community in Minnesota have their measles vaccine. And then there's another one about donor breast milk. But talk to me about how do you deliver, culturally sensitive care? What does that look like on the ground? What does that look like every day?
I think it's not having hierarchy. We are having coffee together, we're chit-chatting, and we're bringing up topics that are important to community, but a lot of people do not want to talk to their healthcare doctors or nurses about. We give them the space to learn from each other, and we're able to correct some of the misunderstandings by me just dropping a couple of apples, I always say. With our group, the last cohort, we had 75 moms. We checked all of their kids, and only 12% of them had their kids vaccinated. And then by the time they graduated a year later of meeting us, and 89% of them had their kids vaccinated. But that it wasn't something that we did one day. It took 12 months of getting together, a lot of WhatsApp messages, and building trust with those families, and not just with the moms, but with the dads, knowing that the people that are telling you this information, I vaccinated my kids, telling them with a story of why I vaccinate my kids. For me personally, one thing that I do share with them is my little sister. We lost her when she was 6 because of measles back home. And I wish she had a chance to get vaccinated, because she would have been here today. And I do show all of my kids how on time they've been vaccinated. And it helps when your doctor or your nurse practitioner humanizes that experience, but also doesn't punish you or almost like tell you, oh, this is how it's supposed to be done. And and one thing that I did take back from meeting with this group is how we offer vaccines to patients. So when I come into the room, I just don't go, what brings you in today? I connect with those patients, because sometimes you only have 15 minutes with them. And how do I make this 15 minutes the most amazing 15 minutes of both of our time? So giving them one thing that they love to talk about. So supplements is a big one. Supplements. So vitamins, especially vitamin D, is a good topic to bring up and a way to connect. So someone's blood pressure will be 200 something and they would want to talk about supplements, and that's fine. But then I go, oh, I care about this too. So you talked about yours. So just making deals with patients and offering them, hey, instead of saying you're due for this vaccine, I am so happy to offer you the MMR vaccine. And that, because I'm excited about it. Just human nature, they get excited. But then we didn't want to keep that information to ourselves. How do we share it with everyone? And our communication director is actually a journalist who you may know, Mokhtar Ibrahim, amazing, amazing guy. And he's just like, okay, let's share it. Let's write a post on LinkedIn so that other doctors, other nurses could find out. So what we're doing is sharing stories with other people so that we could do some systematic changes also.
And then I'd read something about donor breast milk. Can you talk, like that one? That one was such a fascinating story, but I didn't see all the details.
So as a Muslim or someone who practices the Muslim faith, we cannot do donor breast milk, because then the person that you gave your milk to, that child becomes your kid. And then kinship, so many different things. But when a baby is premature, they cannot use formula, or they can't have formula, or to regulate their blood sugars. So how do we help families understand how important it is? And can we actually get a fatwa? I remember saying that I'm going to get a fatwa, and someone laughing at me and saying, oh, that's not doable. You can't change the religion. This doesn't change. I was like, watch me. And it wasn't not like that, but just saying that let's learn a little bit more, because maybe we can. We brought 6 doctors or something, and to explain the reasoning why this is important to community members and mosque leaders, and 9 mosque leaders together. And we talked, and they're like, no, absolutely not. And then we left. We came back together. A lot of education happened. At the end, we did end up getting that fatwa. But now that fatwa is being used in Dubai, it's being used in Somalia, it's being used in predominantly
And explain
Muslim
what a fatwa
countries.
is.
Fatwa is a Islamic, something that says, yes, the religion shows when it's needed, you can do it. And it's allowed. So it's almost a degree of saying that, yes, this is allowed in the religion. And because of that piece of paper and some videos that we did, it ended up that families are actually saying yes to this, and babies that really, really needed some of them maybe even saved lives because of it. So I'm happy. So when someone says no, we just got to find a way to get a yes or just more education, honestly.
That's such a remarkable story. I mean, and George, talk about this is such labor-intensive work, right? And, we think about these populations in isolation, but they're not in isolation. I mean, measles is an obvious one, but can you talk sort of more broadly about why these steps are important? It's not just about like whether or not your kid gets measles, but, all of these other issues. Why are they important to the community at large, not just these specific communities?
Yeah, this is an excellent example that she talks about. The medicine's both an art and a science. And, this is the idea of bringing religious leaders in to help solve a problem, which is a cultural problem. As a Western doc, I can tell you I had no class on sharing breast milk among people of the Muslim faith. And I probably would have been very frustrated with a baby who was malnourished and trying to figure like, heck, how do I get this kid, better fed? And of course, the Western solution is IVs and, some other, traditional medical solutions. Being frustrated with the parents because they're not supportive of my recommendation here, and having no understanding culturally of how important this religious view is to these families. But being able to get that through a process is very important. We see that a lot in society around the social determinants. Social determinants being things that empower you to improve your health or serve as barriers to improve your health, whether it's education or financing or just transportation. I mean, we have so many things as a society that we have barriers we put in place that have really served as things that stop us from being as healthy as we can be. And not recognizing that remains amazing to me. And if I can tell one story that I've told before, I was the health commissioner in Washington, D.C. I was, Queen of England had come to D.C. to the city, and we were doing the obligatory reverse visit of some kids from the inner city over to London. And they happened to be in the chair of the committees, the health committee, a guy named H.R. Crawford's office. One day when HR had me in to have my monthly whipping, so I understood who actually ran health in the city. And these kids were kids that were going to go on a trip to London, and I, my suit, tie, middle class upbringing, and I'm talking a lot about how wonderful the trip would be for these kids to go to London. Of course, I'm trying to figure out how I can get on the trip. I failed, by the way. But I got the strange, and then the kids went off to lunch, and we were talking about it, and I got the strangest look from him. You're talking to someone and realizing that you're having a one-way conversation. And what he said to me, for those of you who've been in Washington, D.C., these are kids in Ward 7 and 8, poorest part of town. And what he said to me was these kids weren't excited about going to London. What they were excited about was going to National Airport. Well, these kids who lived in the poorest part of town had never, in a city 10 square miles, have never been to the airport. And their view of the airport is these things, these planes that fly over the horizon, over their community, and they've never seen where they came from. And so my realization suddenly was the understanding of the world that these kids had was about 10 or 12 square blocks. That's their reality. Poverty, violence, poor schools, 10 or square per box. Going downtown in DC was a real field trip for them. Now, once they got to London, they were going to have a wonderful time, and it turns out they did. They had a wonderful time without me. And, but cultural, social environment is extraordinarily important if we're going to make a dent in improving the health of people. And we have to expand their horizons. And it's programs like this that help span their horizons because they bring a degree of cultural sensitivity and understanding to the medical encounter.
Just to add on to that, one thing that we did strategically, or just because I love art, when you walk into our clinic, you will see 3-piece art, big art on the wall, and one is that we ask community members to bring in or art that represents dress that they wear to weddings. So our Latina or Spanish-speaking group brought one, so we've got that there, or an art piece that was made into it. And then for our Somali or East African community, and then the area that we're in has a lot of Native Americans. So we've got an art piece in there, and it really brings people together and a way to talk to each other, even if they do not speak the same language. They're able to connect to that art because they're sharing, oh, I saw this, my grandmother wore it to her wedding, or this is something that we wear to a Sundance or something. But you hear those stories as I'm walking in and out literally every other day or maybe every day. And that connection to each other too.
There's something amazing about feeling seen, which I think a lot of people don't get the experience of every day, and you don't think about that. But I even think about, this is such a small thing, but being Indian American and or South Asian and just not seeing other South Asian Americans on TV until my adult life. And that was, and it was such a big thing for me to finally see that. And, but it's hard to explain to somebody that has always been seen and represented, right? What it means to finally be recognized and represented, and that's a big thing. Okay, well, let's turn to Operation Metro Search. So you started Inspired Change Clinic, and then almost immediately, Operation Metro Search came to Minneapolis. When did you realize the impact that this was going to have on your clinic? When did you say, okay, this is big?
I think when 60% of our patients were calling and canceling their appointment or not even showing up. And our patients, for the first time in my life, I feel like our patients show up and come on time and are just sitting there talking amongst each other. I'm like, something is off. Can we find out what's going on? And being in the heart of Minneapolis, we knew what was going on. We saw that there were a lot of conversations going on from November 25th, I would say, till December 2nd. I started to say, okay, this is really taking an impact. And then hearing from other healthcare organizations or other federally qualified clinics that are saying, hey, we're seeing the same thing. And people are not showing up for their prenatal visits. They're not showing up for a chemo that they're due for, or not picking up their seizure medications. And when we call them, they're not answering the phone, or if they answered, there was this thing where people kept hanging up on us after 3 minutes because they were told if they were on the phone for longer than 3 minutes, you could be tracked or something. So we would be talking to someone and then someone just hangs up and then we would call back. And I didn't know, I was like, why does the phone keep cutting off every time? And then that's when I found out someone was like, oh, it's because of a way to make sure that we're not being tracked. It's like, okay, good to know. So now I would just speak fast and then call back rather than draw on it. But yeah, that's when I realized that this is actually happening. And then how do we change this, or
how did you pivot? What did you start doing?
Dr. Beth Thielen and Dr. Neil, I remember just calling them and saying, we need to do something. We know doctors. I'm pretty sure they're struggling with what's going on. These are their patients. let's call our friends and let's see what we could do. And then I find out that there are a lot of other rules that go into doing home visits, because that's not something that we did. It's like, okay, let's figure this out. So we looked into malpractice insurance. We looked into different things that we would need to not only protect ourselves, but the patients that we wanted to take care of. And once that happened, we created a list that started with 10 people, and it went up to 150 doctors by the time we were done. I can't count how many nurses that we had. We had a hotline. We had so many different things going on. But then we realized it wasn't just the sutures that needed help with, or someone needing their medications. It was about food. It was about mental health. It was so many other things that these people needed in their home. And the fear was real. It wasn't something that we were just making a big deal out of. Minnesotans honestly don't do a lot of that, I think. But it was really scary. And for even like us someone that looks like me, it was scary. And it was something that my dad would call me and say, you need to stop doing this. Do not give another interview, because he worried for me. He worried for our whole family. But was thinking about myself, and just staying at home would never make sense. And everyone that volunteered had the same thought.
I mean, what did Operation Metro Surge look like in Minneapolis? I've heard another person describe it as it felt like an occupation, and people were being pulled out of their cars off the street.
We had someone whose husband was being detained, and she runs into our clinic and locks herself in the bathroom. At the time, we didn't know that they can come into the lobby, but we had a lawyer that I know very well, an immigration lawyer. He's like, yeah, they have the right to sit there as many hours as they like. As long as that person is in that room, though, and it's allowed, she's safe. So just pivoting with that and making sure the patients that were there felt safe enough. And the whistles that were going off, I will never forget, there is this older grandmother who is Ukrainian descent, recently immigrated here, and the whistles literally bother her so much that she would just put her hands on her ear. And for people, the whistles were a way to let others know that it's not safe, this area. But for her, those whistles that were going off, it was literally triggering her own memories of where she came from. So it felt like a war zone.
Yeah. I mean, and what did a typical day look like for you during Operation Metro Surge? Or or maybe you can describe one day. It wasn't typical, but.
I don't know if there wasn't a real typical day. It was just go with the flow kind of thing. We would get a phone call, phone calls were just going off. And then once we received them, we would figure out someone on the list that was available that could do home visits with us, depending on what the call was for, making sure that we had a couple of people that would pack the food or a diaper if that was what was needed, and then we would go there. And then we started doing large grocery shopping from Costco and places, but then that became a trigger where someone would know that you're doing something, then we started doing little groceries at a time and not a lot of it. So trying to figure out ways to bring care to people or food to people, that became just our norm.
So what would happen if you went to Costco and got a big shop?
It wasn't myself, but it was a couple of other people that were pulled over, felt like they were harassed or something, and they were. And then, so because of that, we wanted to make sure that we weren't a target. So how do we do enough groceries but not have to go every day? That just became our norm. One story that I would like to share is this little boy. We went to take care of his sister. The school called us. First of all, we shout out to all the social workers that work at schools. They would see a child who was in need, especially these kids who were staying home. Parents were staying home, but were really, really stressed. And multi-generational households that were stressed out. You can only imagine how that feels. But they would call us, and we went to one of them. And once we got there, I had to do a suture, got that done. And then as a mom of 3, I know what a house that has food looks like. And I asked the older sister, hey, do you guys need food? And she says, no, we're good, because she didn't want to get her parents into trouble. But this little kid runs towards her and says, we need food. I don't speak Spanish besides hola. And I understood every word this little boy said. And that was the most hurtful thing that I heard, just because of the pain in those kids' faces and how they feared us, even though we were providing care to them because it was necessary. But they didn't know that if we brought food, then are we going to report them? Will mom and dad get deported? What's going to happen to them? No child should ever have to think about that. So we went to the local grocery shop, and I was just like, let's drop everything in, and brought things, not only what they needed that was necessary, but adding chocolates, things to just make light of things. And then afterwards, I remember reaching out to everyone that I know and saying, can you donate books to us? Hennepin County Library, because my safe place is reading when things get tough. How do we encourage that so that these kids can escape? And we started delivering books to them too.
Is there precedent for Operation Measures? Has anything like this ever happened before? I know we use the term unprecedented a lot these days, but.
Yeah, let's see, Nazi Germany. Nazi Germany. This was an inhumane, illegal, unconstitutional occupation of a city that targeted people by race and ethnicity. And we need to call it what it was. And they ain't done yet. It created community fear. It created direct negative health impacts on people who, as you heard, could not go for care, who were afraid to go out. In the first Trump administration, they tried to do some of this by changing some of the rules around eligibility, around services, et cetera, and tried to tell health providers that they now needed to be police officers and break their professional oaths by quote unquote turning people in and things like that. And the health community basically said no. So they went to poorly trained people with badges to do this. If you look like me, you were at risk. And I heard of stories of kids, people in this town who were of color, whose kids' white friends ghosted them because they didn't want to be picked up, because they didn't want to be with these folks because they were afraid. This doesn't just impact the population it impacts everybody. And it has enormous implications for the health and well-being of the community. It has implications behind social solidarity. It fundamentally undermines the trust in communities. It fundamentally undermines social solidarity in our communities. It undermines the ability of our law enforcement officers, who put their lives at risk each and every day for us, to do their job successfully, because you don't know who to trust. Yeah, there are bad people out here, and we need law enforcement to enforce the law. But under the rules of the law, we need them to do it respectfully. And that's why community policing works so well. Now, I'm not an expert in criminal justice, but I grew up in Chicago and I grew up in the hood. I understand fear of police. I understand fear of gangs. I understand what a safe community looks like. I can begin to understand religious persecution. I personally have not experienced that. But when you dress a certain way, when you walk a certain way, when you wear religious symbols, when you're of a certain racial hue, if you speak a language other than English, whatever community you're in, and someone decides to target you for any of those characteristics, you're at risk. And it creates enormous problems for the health sector to try to do our job, which is, to maintain the health and well-being of our communities. So, and I gotta tell you, this group of folks have even gone further to try to criminalize normal professional behavior. And so it puts you in a terrible situation when you have to make a decision about, am I going to undermine my job, my family's well-being, my professional future, which is for my family's well-being, versus my patients? Well, that's a terrible situation to be in. And so, you try to find a way around that. You try to maintain your professional relationships. You try to protect your patients best you can. So it's programs like this that have grown to get volunteers to both do workarounds, go in the community, find ways to deliver things. Your definition about this being a war, it is no different than a war. If you think of any war that we've had, where you've had resistant groups, this is exactly what happens. You build up a underground medical network. You have young kids who become runners. You survey those community needs. You pass that along through all kinds of ways so that you, quote unquote, won't get caught. You raise money. You build community infrastructure. Now, it does build, to some degree, some additional surrogate social solidarity. But is that how we really want to live as a society? So the fact that the community stood up here, put their foot down, and drove these suckers out of town, I think is something that we should all applaud. But the question is, should we have to do that? At what point should we have put our foot down as a society before that happened? And realize that the mental health implications of this didn't go away when the Gestapo agents left. Right?
I want to get to that in a moment. I wanted to ask you one last thing about Operation Metro Surge, which is, what are the stories that have stayed with you the most? And I know there's a story about a woman nearly almost delivered a baby in your car that I want you to tell. But the reason that story is so interesting to me is I think it sort of touches on a lot of what you were saying, which is you're trying to find this line between delivering care but not harming the person further, and there's a chance this person goes to the hospital. Like, what if they get taken in? So can you share that story with us?
I think what families were seeing were hospitals were not safe. I think, and this was done maybe on purpose, where a lot of them would be around healthcare facilities or like churches, places where people, when they're most in need, where do you go to? But I think of, I would go to my mosque or go to church, somewhere where you would feel the most safe, or hospitals. And those places didn't feel safe. And so how do I go to those places where I know that, one, I have to sit in the lobby, because the way that healthcare system is made, you check in and you have to sit and wait, and you're being told they're able to come in there, and there's not much that can be done. And I think large healthcare organizations were not sharing what the rules were in the beginning, because things were changing every day, day by day. And the communities, what they were really, really wanting was tell us, what is our rights? What should we know? What are you guys allowing? And all those questions were not being answered in a way that everyone would have felt safe. So, and understandable why organizations may not want to share everything, but at the same time, community already has mistrust with healthcare institutions, and that just makes it harder. So when we would go to a home and clearly that patient needs to go to the hospital, and you tell them, I'm going to take you, or call the ambulance, and they're begging, literally, this mom, I know what labor looks like. And the OB that was with me is like, yeah, she's 8 centimeters dilated. I was like, oh, she is? She was worried about
10 centimeters, for those of you who don't know, is when you have a baby.
10, the baby's out. And she's not a first-time mom, so it could go anytime she could have that baby. And we knew that. But for her, she wasn't crying and she wasn't yelling. She was almost like planning and telling us how she's thought about having this baby at home.
So you showed up to her house. She was 8 centimeters dilated.
Mm-hmm. And then she has other kids in the home with her, and we are talking her into going to the hospital because we kind of understood her background. And the OB that's with me was like, no, we need to take her in. So we ended up taking her, and the whole time I keep looking back, I'm praying. driving, just going, okay, just don't have the baby back there. They're back there. And we finally got there. And now what do we do with the kids in case something happens in the
So
hospital?
you took her and the 2 kids to the hospital. Okay.
In that small car, yes. And then we get there, and then we found out, someone tells us that our notary, public notary person, that I didn't even know hospitals could have someone on hand, but we had someone drive up there, meet us there, so that those kids could be taken care of by her neighbor, just in case she gets picked up. Then we had a backup plan for the babies, because grandmother lives far, and it's just I know the whole story now. But mom has, once we got her to the hospital, within a couple of hours, she had the baby. Kids were safe with a neighbor, and it was because we showed up. That now, afterwards, not her, but her family members came in and signed up to have their primary care to be at our clinic. And they were like, thank you for showing up and for coming up, not only just showing up to just take her there and leave her there, but also making sure that those kids were safe, also making sure that they had food, and getting her a couple of diapers, because she wasn't going into work a couple of weeks beforehand either. So just making sure that they were okay. And for me, we were able to do that because our clinic doesn't just, and I'm not plugging Inspire Change in, but honestly, our main goal was to have equity to be part of the foundation of our clinic, and not to just provide sick care, but health care. And health care meets you where you're at. And 80% of our health happens outside of the clinic. So how do we bring that in? So we do resume help on Wednesdays if someone is interested. We partner up with Dress for Success, so that way you could go to your interview and wear a nice dress. And that is what healthcare should be.
Why is the traditional medical establishment not set up to deliver this type of care, right? I mean, they're not. They're less proactive. They wait for you to come to them. Why is that? Like, why have they failed so badly at delivering this type of care?
Yeah, medicine is designed around a disease model. You get sick, we fix it. And that's the disease model that we've created. One of the reasons we're different than the other industrialized nations in the world is we are focused primarily on this disease model. The rest of the nations that do much better and spend half as much money as we do, by the way, is they focus a lot on primary care, they focus a lot on wellness. They've set up a system to make sure that everybody has, some basic access to universal access to health care. They have a much stronger investment in social supports. People talk about why some parts of the world didn't have to do as aggressive lockdowns as we did during COVID, was because they had paid sick leave and universal health care.
Do you think that's by design in the U.S. or by accident?
No, we're a nation that believes of this individuality, and we're still having this big debate about the right to health care and individuality. I think at one point we had come to some consensus that everybody deserves to have health care, but there's a group of people right now that are working very hard to undermine that with the $1 billion cut or $1 trillion cut in Medicaid and the exchange dollars. Yeah, I mean, we're having a big debate about whether or not just people should have health care, but whether or not everyone has the right to health care. Yeah. We still as a nation haven't agreed to that.
I want to make sure we leave time for questions. If you have a question, please line up at the microphone. I want to ask Munira, though, before we get to questions, the threat of Operation Metro Surge, hasn't ended. I know it's moved around. So talk to me about both. You have this kind of fear that's still in the community. Also, you have people that were in immigration detention and are now back in the community, people who were in the community and they've been deported. What do things look like right now? And like I said, please line up if you want to ask a question.
I think things are definitely normalizing. I think people are hungry to have things normal or back to normal or what our new normal is. Something that I'm seeing is a lot of need for mental health resources, or what now, and not just for the people that were impacted the most, but the bystanders, or like the secondary trauma for healthcare workers. Yeah, the other day you guys did a tour, and a couple of the doctors were there who did the home visits, and afterwards they all texted me and said, "Oh, this was so therapeutic for us." And I didn't even think about getting together afterwards to debrief and talk about everything that we went through together. And now I'm thinking about, how do we do that? You guys provided that for us by coming to the clinic and doing that tour, thinking that we're just sharing stories, but by us sharing our story and what we went through, it was therapeutic for them also. And we're noticing that a lot of people who would have, when you go to your doctor's office, you're told to fill out this paper that talks about your mental health. Have you lost interest in things? People that normally have like a 2 or 4 now are having 14 and needing to go on medications. And it's not just people that were undocumented. These are people that have lived here for 30 years, but because they look different, feel like they have a target on their back.
Please ask your question.
Hi, thank you so much for this talk. I'm curious, my name is Natalie, and I work for the Cap Times as their opinion editor. Before that, I was doing statewide mental health reporting for the Milwaukee Journal Sentinel. I'm curious if you can talk a little bit about the ways that Operation Metro Surge impacted the clinicians themselves, and thinking about Inspire Change Clinic and the work you were doing every day. How did you ensure that you and your staff remain safe and functioning enough to take care of other people amidst such chaos and concern?
Great question, honestly. I would say in that moment it was hard, especially when Alex was killed. I think Renee, we would do home visits, and for me, strategically, anytime that I was sending someone of color, we would have either a nurse who was Caucasian or a doctor that was Caucasian, just thinking that that was going to keep both of them safe and the family safe. But we realized that no one was safe. And that is when I started to worry for people that were doing the home visits, saying, okay, should we stop? Should we take more telehealth? And started teaching people on how to download or how to use their MyChart, which is a way for you to send messages to your own doctor and to connect with them. But we were getting so many calls that we couldn't ignore it either. And we were in such a survival mode. If I could redo it, I hope not to, but it would be having someone that we could all connect with, maybe at the end of the day having a debrief, or maybe checking in more. That is one of my regrets, that I wish we did more of that.
Joyce Frieden, MedPage Today. I'm just curious, all this stuff is happening at a time when there's continuing shortages of healthcare workers, nurses and doctors. So I'm wondering if it's how difficult it's been for you to hire folks for the clinic, and also for Dr. Benjamin. How do you see this as kind of fitting into the overall larger picture for the healthcare workforce?
I think the doctors and the nurses that were volunteering felt hopeless by not doing something in that moment. They wanted to do home visits, and the organizations that they were working for didn't have something in place where they were able to do the home visits. So this was their time where they felt like they were doing something, and by not doing something, that would have had more harm on their own mental health. So it was, I can do something. I'm off. I'm off 2 days a week. These are the hours that I'm available. And what little thing can I do? Do you want me to run some groceries to someone? Do you want me to go and check on a family, or just sit with someone? This was their way of feeling better for themselves. And our clinic, it's so weird. But everyone who's applied or has wanted to work with us are people that I personally have worked with or valued in working with them at other large healthcare organizations. And we're bringing like-minded people together. But that also puts me into trouble because we're all wanting to do something good, that we're saying yes to things and not thinking of the how do we pay for this? Where we're like, oh, we'll figure this out later. But
How do you pay for things? Like, how do you do this?
I would say in the beginning, we were doing a lot of, when we did the home visits, people needed their INR checked because they had medications that they were taking and would need to get their blood drawn and were not leaving home. So we would do those blood draws, come back, send it to lab, and then lab will bill us because we weren't billing them. When I realized how much it was, I remember again reaching out to my few trusted doctors and saying, I think we need to either one, figure out a way that we could get these bills paid, because I can't go to my board and tell them that we spent this much amount of money. So we did a fundraising, ended up getting $58,000, and I think our lab bill at the end came up to be almost 20% of that money. And then we did a lot of medications that we picked up from pharmacies that we needed to pay. So a lot of it just went back into it, yeah.
Before you get to the next question, I want to ask one quick thing about, well, not quick, but Operation Metro Surge was very visible. It was on all of our screens. And I said TV earlier, but most people are watching on their phones, but just on all of our screens. But now we have the One Big Beautiful Bill Act. And that's had a sort of, that is going to be, I think, fairly devastating to a lot of your clients and a lot of people in these communities. So refugees are cut off of SNAP and Medicaid, for example, and then there's sort of broader Medicaid cuts. And Minnesota in particular has drawn the ire of this administration, and that's precipitated some cuts. Can you both sort of talk about that and how that's, it's a little bit quieter. It's not as visible. It's not people in bulletproof vests and guns, but I imagine it will be fairly devastating as well.
Yeah, you need to count the bodies. People are going to die from this. People are going to get cut off of health care. Medicaid is already underfunded, dramatically underfunded. And you can't take $1 trillion out of a grossly underfunded program. All that nonsense about fraud and abuse is nonsense, okay? It's also important to understand that the cuts are already impacted. People right now focus like a laser on the exchange cuts. But if you are a member of a legislature and the Medicaid cuts to come, which aren't supposed to actually, quote unquote, hit to 2027, I remind you that for those elected, those jurisdictions whose budgets started this July 1, they go through next June 30th, 2027. That means they had to make budget decisions already around their state budgets. So you're already going to begin seeing ratcheting back of services, everyone trying to figure out who to focus on in a variety of ways. So those cuts are very, very problematic. And of course, they go to those communities and those populations that are most in need, most distressed. And of course, Medicaid pays for a substantial amount of long-term care, which really hasn't been paid attention to at all, as a growing number of people are the baby boom generation. So no, the HR1 was a bad piece of fiscal policy. It has enormous implications. What I would hope is that a new Congress will come in and will be able to rapidly fix those cuts. I don't know how much of it they can fix.
Are you seeing the impact already?
But we'll hope so.
We are. I am a major believer in networking and finding ways to bring care to people. We have partnered up with an organization called Kapal. They are an amazing, so what they did was, they were like, okay, we could take care of 100 patients for you, we'll pay for their bill, but give us a discount. So almost negotiating with other organizations that are doing philanthropy work to provide care to 100 patients. And what we did on our end were we are not billing at level of, if we said level 3 or level 4, it would be $613 if you went to any other place. This person doesn't have insurance but needs the care. So you could get one full visit, you could get your medication refills under $300 and get your lab work. So, and that comes from a fund of someone who said, I want to take care of these people. For me, especially for someone that looks like me right now in Minneapolis, I'm not looking for grants. I'm just looking for networks that I can work with and we can bring care to, just so that we're taking government out of the whole equation.
And let me just say, and for those red states, this will be catastrophic. To remind you, they didn't expand Medicaid, and now they're going to lose a substantial amount of their funding. Most of their Medicaid matches in the 60 to 70% range, federal money to state money. So they're going to take an enormous hit, and you're going to see a lot of rural hospitals close because of that.
Laura Beal, I'm a journalist in Dallas. I was wondering if you could talk more about the impact on children. Like the news coverage was dominated by these images of the kids who are affected, and I can't help but think that they're seeing lasting effects. Could you tell me how the children who are affected by this are doing?
You know, someone told me after COVID, 5% of kids just disappeared from the school system. And then when this happened, kids were taken out of the school and were doing more homeschooling or e-learning. And a lot of them may not go back to school the way it was. And when there's a couple of family members in a home that sometimes may struggle with being home or may have mental illness or home may not even be the safe place to be for 8 hours, that has a lot of impact on those kids. Even when we think things have gotten better, it has a lasting impact on them. And some of them saw their mom, dad worried, or maybe dad never came back. So how do you feel safe in a place where you felt so unsafe just a couple of months ago? And that trauma, we may not even know it right now, but the next couple of years, if we do not give them the care that they need, which is more access to mental health, I can't imagine what's going to happen, and that worries me, honestly. And taking the insurance or not having access to care, that will make it worse. So I hope that my hope is that changes or real people show up for those kids.
Hi, I'm Jason Kane from NBC News. Jumping off of that question, I was wondering if you worry about any other long-term effects. For instance, kids not getting vaccinated because their family's not taking them in for their, wellness visits and that kind of thing.
And we talked about this too, like there's preterm births like skyrocket in situations like this, and those have long-term effects. But
I mean, we know from COVID. I mean, we were already in a deficit because kids didn't go to the doctor during COVID. We're trying to play catch up, and then we had on top of that the anti-vaccine effort. And so the more of these kids we go underground, and for a variety of reasons don't get their shots, they're going to be put at risk personally. And of course, if they go back to communities that are under-vaccinated, we're going to see more spikes in infectious diseases, vaccine preventable infectious diseases. So no question about that.
Besides vaccines, are there other health things? Like I'm thinking, like I said, there's sort of this growth of preterm births or these moms who are not getting prenatal care. I mean, are there other kind of health consequences we're going to see 10, 15 years down the line?
Oh, no question about it. I mean, we'll see higher infant mortality rates. We're going to see more preterm births. We're going to see more maternal mortality maternal complications during pregnancy. The big S word, stress, through all these communities. The question about kids, these kids have got to be angry, resentful. Their parents got locked up. How are they going to view law enforcement? What are they going to do when they get stopped on the street? Are they going to be compliant, or are they going to be protective of themselves and their friends? No, we're creating a a very fearful environment where people are going to react in a way that is common sense in terms of trying to protect themselves. But the long-term implications for maternal child health, infectious diseases, chronic diseases, to the extent that hypertension is driven by high degrees of stress, poor school performance, all the things that we were concerned about when we locked ourselves down just for a few months from COVID, delayed performance in school, more kids, and then the cycle, right? More kids become dysfunctional in school and without the proper mental health and social support services. It becomes a revolving spiral. So yeah, it's a
Trauma,
problem.
right? Long-term trauma.
And the early trauma doesn't go away. It's there and it persists.
My sister-in-law is a middle school teacher, and this is different, but she's still seeing COVID kids, and she's still seeing like behavior problems that didn't exist before. Kids who don't have good handwriting because they never went to, like they did Zoom kindergarten, and she's still kind of seeing the aftermath of that. So.
Well, the social isolation. I mean, COVID was bad enough, social isolation. Now, these kids are now, again, afraid. They're afraid to engage each other. They don't know how to talk to one another.
And I think a lot of the parents lost their job because they weren't going to work and now are in the process of looking for jobs. And one mom said, I'm too busy with survival, or like figuring things out, than to think about making a well-child check visit, let alone just come in for a vaccine visit. So we have this thing where we educate you about vaccines, and you come in you meet with the nurse, she gives you the vaccine, and you're out. And she had some appointments made, and then we called her to see why she didn't come in, and she said she's too busy figuring out life. So parents are really struggling right now between providing food for their kids or taking their child in for vaccines.
Go ahead.
Hi, I'm Kevin Ritter with AHCJ, and I was just wondering, since we're in a room full of journalists, I was wondering what your thoughts were of coverage during Operation Metro Surge, and if there was anything that was critically missing from it, and what you'd like to see more of going forward.
I don't know if you guys have seen, but Jenna, she works for Cat 11. There is a video of her where she got, something was sprayed on her and tears are coming down. And the way that our journalist from Sehan Journal, Star Tribune, really told the story, but humanized it. And my 16, 17-year-old son, I was like, sign up for journalism school in your high school, because I was like, they offer that. And as a Somali mom, an immigrant mom, we all want our kids to become doctors. And I'm like, you should become a journalist. And that's how—
I wish you were my mom.
No, and I'm serious, because I never thought those words were gonna come out of and not because I'm in this room, but I would say that because I didn't grow up that way, but having the stories told in a human, real way. We were reading the things that we were seeing in the homes. We were seeing pictures that looked like the people that we were taking care of. It felt almost like there was this unity around, because of real journalists that were telling the story and not YouTubers or anything like that. But these were people that we actually knew. There are several journalists that I know by name now that just because they told the story, and so grateful. So
I would like to add, I'd like to see more stories around these indiscriminate use of riot control agents. Because I think that it's being used willy-nilly, is perceived to be benign. It is not. Rubber bullets, they're not benign. And I would like to have some more stories on some of the quote-unquote crowd control techniques that are being used, which I think are being done indiscriminately.
Well, before we wrap it up, I have one question I want to end on. It's a little cheesy, but I think could use this, which is, what gives you hope right now? Because it feels like a very dark time to me, and I have to, I need to outsource my hope creation. So.
Yeah, my granddaughter participated in a protest where her class walked out.
How old is she?
Over immigration. She's 12. And the school helped them. They knew they were planning it. Her mom helped them make the sign, and the school made sure they were able to do so safely to, do their First Amendment rights. And I was very pleased to see that both the school participated in a productive way and the kids were able to do that.
In a society right now where we're giving kids backpacks that can be used as a bullet shield, in places where kids cannot get access to health care, what really gives me hope is communities like the real everyday Minnesotans who came out when it was negative degrees to show up for their community members. That is what gives me hope. Calling Minnesota home is what gives me hope.
Absolutely. Well, thank you guys so much. I really appreciate this discussion.